Laser lipo of the abdomen, we're going to demonstrate the steps. First thing, we're going to numb the skin. We've already made one incision. We're going to numb up the other incision. That's a regular needle, like everybody is used to. Then we take a knife and we make a separate incision. Now you'll see ads for silly sayings like no knife. They use another instrument to enter the skin. You can use a punch biopsy just as much. Doesn't change the operation. So it's not incisionless. This is still surgery, even though we call it minimally invasive surgery because the incisions are small. This is the real numbing instrument that people worry about. It's a cannula. It is not sharp. It's basically a tube, and we insert it through the incision and slide it, and then go ahead and start pumping. We pump in fluid. Sometimes we use a pump. If it's small volumes, we just use an infusion bag. This part hurts. Our patient's being very stoic. The pain levels differ. It does feel weird, but not necessarily too painful. She also has some medications on board to help her relax. So the next step in laser lipo is to insert the laser finder. I don't know if you can see it on the video. It has a red dot. That's just an indicator light. When I push the button, a laser will shoot out. There are different kinds of lipo. They're not going to change the outcome too dramatically, but they'll add, each tool adds a little bit. This one adds skin tightening and liquefying the fat. Especially in cases of prior pregnancy with a little bit of loose skin, I think that's the areas where I find that the laser adds the most. Also, when the patient's awake, doing this step and liquefying the fat a bit does help it to be less painful. And here we go back and forth. This part should not be painful. And we stay close to the skin a lot so that we're heating up the skin with the laser from the underside, which will help create a tightening reaction. Another thing I like about laser lipo and awake lipo in general is that I do feel it's a bit safer. For example, there are many parts of the body where, well, pretty much every part of the body we're working in, we're trying to avoid hitting any important structures. In women with prior pregnancies, the muscle layer is separated and this layer tends to be thin. While uncommon, the risk of perforating anything is part of liposuction. The feedback, when patients awake, they'll let you know when you're hitting the muscle layer or the fascia layer because they still feel it. So that part is not numb, so they'll give you feedback when you're getting too low. And that feedback is lost in under anesthesia. Again, that risk is extremely unlikely. Similar thing is in the buttocks when you're injecting fat. You don't want to go below the muscle because that can increase the risk of embolus. That has garnered a lot of media attention because that risk is a little higher. When we do fat injections awake, again, the patient would feel it if we touch the muscle and would give us a feedback, avoiding one of the major risks. So that's another reason I prefer laser lipo. We're going to insert the instrument and start it. And then in the beginning, it's a debulking, so we use just a back and forth movement to start removing the fat. You can see the fat in the tubing, and a little bit of the fat and fluid will come out. And we'll show you how much we collect at the end. Another thing that you'll notice is there are different cannulas. Today we're using 4 millimeters, which is kind of my favorite size for larger areas. And one of them, for example, is bent. That'll help me go around the corners. Helps me also go upwards this way because the bend helps slide over the muscles. And one of them is straight when I want to work in flatter areas. They also differ in the number of holes and location of holes. When I get more superficial, we want to use one without holes in the top to keep the skin smooth. Another thing I like about laser lipo and awake lipo in general is that I do feel it's a bit safer. For example, there are many parts of the body where, well, pretty much every part of the body we're working in, we're trying to avoid hitting any important structures. In women with prior pregnancies, the muscle layer is separated and this layer tends to be thin. While uncommon, the risk of perforating anything is part of liposuction. The feedback, when patients awake, they'll let you know when you're hitting the muscle layer or the fascia layer because they still feel it. So that part is not numb, so they'll give you feedback when you're getting too low. And that feedback is lost in under anesthesia. Again, that risk is extremely unlikely. Similar thing is in the buttocks when you're injecting fat. You don't want to go below the muscle because that can increase the risk of embolus. That has garnered a lot of media attention because that risk is a little higher. When we do fat injections awake, again, the patient would feel it if we touch the muscle and would give us a feedback, avoiding one of the major risks. So that's another reason I prefer laser lipo. Thanks. Common question I get asked is, how do you know that you've removed enough? That's the part that takes experience. Again, I always tell people your results will depend 99% on the experience of the surgeon and their artistic eye. This is a sculpting procedure, so we're taking a block of fat and trying to sculpt it into what the eye sees as attractive. During the procedure, everything gets swollen with all the fluid we put in, so I rely a lot on my tactile sensation. And here I've noticed that the skin is getting to the thickness I like. And what I do is I start marking that area to indicate with dots, to indicate that I'm happy with this area, to focus on other areas. And at some point, all her abdomen will be marked. That's when I'm done. I'm going to shoot for a thickness that's thinner here to create that sharp line, which is corresponds to her muscles, which looks good. In the center here, we're going to leave a little padding of fat. If you try to remove all the fat here, it leads to severe irregularities, which is probably one of the hardest things to correct and looks very unnatural. All right, so we're progressing, and as you can see, I like to work from different angles. I like to get different perspectives and keep moving my views. As I mark areas, when I like the thickness, we mark them with blue dots. Eventually everything will be marked with blue dots. We're getting close. I'll answer a few questions that are very common with liposuction. The number one question is, does the fat come back? Lipo is not a substitute for weight control. If the patient's good about diet and exercise, they'll stay off. If they gain weight, the usual pattern is that the fat will go elsewhere. For example, arms, thighs. There's less fat cells here to attract them. But that's still not a substitute, because you don't want to go from not liking your abdomen to not liking your arms, then to liking the arms, not liking your thighs. You can't chase the fat around the body. So as we get closer to being done, we're doing the detail work. For example, as you know, a nice six-pack has a groove here, so we'll try to create one. Little tricks, and this is why surgeon experience matters. We put the holes facing upwards, and that's called abdominal etching, when we actually intentionally created depression in the skin. And these are the tricks we use to give the best overall appearance. Thank you. Okay, so now we're approaching the end. As you can see, I've marked all the areas of the treatment that I'm happy with blue. We're pretty much done here. It's a matter of self-tradition. I just leave that little part to the end. This is probably the most challenging part as far as knowing what to leave. If removing too much leads to irregularities, so I leave it to the end for the final checkup. And we're going in as a final checkup. As you can see towards the end, I can lift up the skin with my instruments. That's not possible in the beginning, but that helps me also tell the thickness. You can see how it's thinner on the side, just a tiny bit thicker in the middle, which is what produces the most natural and feminine results. And that's it. That's now marked. I'll put some dots on it in a second. And this concludes our case. We're going to close the incisions. This one I'll leave open just because it's not gaping. That'll help drain the fluid. The belly button I'll leave open again to help drain the fluid. The sides, for best scarring, I'm going to put a small stitch in. Thank you for watching, and see you next time.